Hello everyone. According to World Health Organization, low back pain is a very common health problem worldwide. It is a major cause of disability at workplace and general well-being. There are different causes of low back pain. It may be a muscle or ligament problem, arthritis or disc bulge, or any other problems of osteoporosis. Well, an Ayurvedic doctor treats the patient, not the X-rays and MRIs. Ayurveda has its own method to examine a disease and a patient. CT scans and MRIs are typically ordered to help confirm or discount a clinically suspected process, to monitor the progression of certain structural processes such as disc prolapse or bone healing. A doctor would become successful in diagnosing the case when he could combine the structural findings in the film with the functional findings that he elicits through Ayurvedic clinical examination. There are two modes of action in an oil massage. One is the therapeutic effect of the heated oil, and second is the mechanical effect of the massage. Skin is the most intensive and readily accessible organ of the body, as only a fraction of millimeter of tissues separates its surface from the underlying blood vessels. Research shows that heated oil can act through the principle called heat-assisted transdermal drug delivery. It occurs through diffusion of the oil through the skin. It can be due to effect of the heat of the oil or therapeutic effect of the fat-soluble micromolecules in the heated oil. Heat-assisted transdermal drug delivery occurs through three routes: through the cells in the skin, between the cells in the skin, via hair follicles, sweat and sebaceous glands. Thus, the active ingredients of the oil can enter the microcirculation under the skin and reduce the process of inflammation, which is the cause for edema, pain and muscle spasm. There are different kinds of massaging procedures in Ayurveda, based on different factors like type and quantity of oil used, also type and time of heat applied. Fascia is a net-like structure in the body that covers the organs, muscles, blood vessels, nerves and lymphatics. The fascia called thoracolumbar fascia is connected to major muscles in the low back region and the ligament called anterior longitudinal ligament, which largely supports the spine along with many other blood vessels, nerves and lymphatics. Recent studies show that special nerves called proprioceptors in the fascia control the movement of the spine against the gravity. A restriction in fascia causes pain or tenderness in the muscle and affects the freedom of muscle function, nerve function, blood and lymph circulation. Massage can reduce this restriction, thus relieve pain, spasm and improve circulation, which helps in healing. There are mainly two kinds of pain: visceral pain and somatic pain. Visceral pain is the pain arising from internal organs, like abdominal pain. Somatic pain arises from injury to muscles, bones, etc. There is a third kind of pain phenomenon called viscerosomatic pain. This is the pain which is produced from an abnormality in the viscera manifesting in the somatic system, like left shoulder pain in heart attack, right shoulder pain in liver gallbladder diseases. Stretching, distension or poor blood supply of the viscera may cause viscerosomatic pain. This pain used to be poorly localized and often ill-defined. Thus, gastrointestinal symptoms like constipation, indigestion, gas formation, etc. coexists in most of the cases of low back pain. The discs of the vertebra have no blood supply. They get glucose and oxygen by diffusion through small pores in their periphery. The oxygen tension in the center of a disc is only 2 to 5% of those at its periphery. This makes the environment of the disc acidic. A chronic lack of oxygen, glucose, and increase in acidity of the body causes these cells to become inactive and cause their death. Foods which are difficult to digest, less nutritional, and that increase acidity are harmful to the discs. Also, a less mobile lifestyle which increases stress can decrease the level of oxygenation of the discs. There are two main stages of management. In an acute stage, which is characterized by pain, pain reduction itself is the main area of focus. Ayurveda addresses both somatic and viscerosomatic pain parallelly. That makes it unique compared to other systems of medicine. According to Ayurveda, a functional element called Vata causes pain in the body. The treatment line against pain is called Anulomana in Ayurveda. Ashtanga Hridaya, the famous textbook in Ayurveda, quotes that Shrodo Rutva Anilam Ruthya Tasmat Tam Anulomayet. Anulomana is nothing but cleaning the block in the micro and macro channels in the body. It may be a spasm in the gut which causes viscerosomatic pain or an impingement in the nerve due to a disc prolapse and associated inflammation. It is done through massages, internal medicines, or treatments like medicated enema therapy. In later stages, the treatment is aimed at strengthening associated structures, the discs, bones, and the associated ligaments. According to the condition, this may take minimum up to 3 to 6 months of treatments with diet, medicines, and lifestyle modifications. Take care, because a spine is a terrible thing to waste. Thank you. Bye.